Congratulations to you and the birth of your child. You get to take your baby home. Bringing home a newborn baby is exciting, but can also be overwhelming and sometimes frightening, especially when there are health issues. This video will provide you with information you would have received if your baby was discharged from your delivery hospital. We will provide you with an overview of common questions that arise with newborn care and some precautions you should take to keep your baby safe. As parents of a newborn baby, if you have any reason for concern, do not hesitate to contact your doctor and put your mind at ease. We will begin first by learning the proper safety measures for your infant's car seat. Then, we will present a brief overview of vaccinations. Next, we will learn about a safe sleep environment for your child. And finally, we will present general newborn care. This includes bathing, umbilical cord care, and taking your baby's temperature. Your infant must be placed in an approved car seat facing backward. Unless you have been specifically instructed by your physician, there is no need for a special car seat. If you are not sure how to properly install your car seat, any fire station will gladly check it for you. Always keep your baby in view. Infant car seat mirrors can be set up in your vehicle so you can check on them often while driving. If someone else is driving, you may choose to sit next to your baby in the back seat. Vaccines are given to infants to protect them from serious illnesses. Timely administration of vaccines are important to work effectively. Some patients who have undergone open heart surgery or received blood products will need to have their vaccines postponed 6 to 8 weeks. Please confirm with your doctor for your child's specific vaccine schedule. In all cases, you can help protect your baby by immunizing other family members that will be in close contact with your child. Sudden infant death syndrome, also known as SIDS, and sleep-related infant deaths is the leading cause of death of infants from 1 month to 1 year of age. It has been shown the risk of these deaths is the highest when a baby is placed in a new sleep environment. Heart babies and infants who have spent time in the NICU are some of the highest risk for sudden infant death syndrome. It is critical that you place your baby to sleep in the safest environment.
I'm Maura Hinke. For the first part of my career was a kindergarten teacher, and I'm lucky enough now to stay home with our 2 kids, Owen and Annie.
And I'm Sam Hinke. I'm a pediatric cardiologist. I have a love and passion for taking care of kids with heart disease.
Charlie is our first son, and we could not have been more excited when we found out we were pregnant with him. He just fulfilled our lives completely. After 3 weeks, exhaustion took over, and Charlie died on April 28th, 2010, a victim of SIDS in an unsafe sleep environment. And since that time, we've worked really hard to educate other families about SIDS and safe sleep so that nobody else has to experience the tragedy that our family did.
And fortunately for most families, they go to sleep, they wake up, and they live a happy, healthy life. But for our family and for 4,000 other families like ours a year, when they wake up, their baby doesn't. We know that about 80% of these are because these recommendations weren't being followed. I would hope that new families and old families, child care providers can do everything they can to help keep their baby safe, and that's to follow these recommendations all the time.
But I think that Charlie is making an even greater difference. I think he's changing lives every day. If even just one parent hears our message and changes the way that they put their baby to sleep, it's worth the pain, it's worth the heartbreak that it takes to share our story.
Remember the ABCs of safe sleep. Always place your baby alone, free of pillows, loose blankets and stuffed animals, on their back, and in a crib in your room. Follow these do's and don'ts for every sleep, unless your doctor instructed you to use an alternative sleep arrangement. The do's and don'ts list for safe sleep may not always be convenient for parents and their infant, but are essential and potentially life-saving. These simple measures will ensure that you are placing your infant in the safest sleep environment. Do not soak your infant in water until their umbilical cord stump or belly button stump falls off. If your child has a surgical incision, do not place your child in a tub or soaking bath until the incision is completely healed. Remember, baby skin is very sensitive. It is not necessary to bathe more than 2 to 3 times weekly. When your baby is unclothed, they can get cold very easily. So when bathing your baby, it is important to make sure the room temperature is warm. Always check the temperature of the water you are using with your wrist or elbow. It should only feel warm to touch. For sponge baths, have your baby wrapped in a towel, only exposing the area at the time being washed. Lay your baby on a clean, flat surface. Clean your baby's face first. Begin by wiping their eyes from the inner to outer section, using a different corner of a washcloth for each eye. Once the eyes and face are clean, continue with normal bathing. Keep the area around the cord clean and dry. Be sure to keep the front of the diaper turned down away from the belly button stump. This will prevent the diaper from rubbing against the belly button stump, which could cause the skin to get red and even bleed. Do not use lotion, rubbing alcohol, or other skincare products around the site. If the belly button stump gets swollen, appears red, or has drainage, call your doctor. If you think your baby may be feeling unusually warm, check your baby's temperature. Remember to follow the instructions that came with the thermometer. Babies less than 2 months old should never have fevers. If your baby's temperature is 100.4 degrees Fahrenheit or higher, call your doctor immediately. With so much information to remember, it can be helpful to keep important phone numbers handy, along with a list of your infant's medications and medical history. We hope this video provides you with valuable instructions on how to care for your infant child. The doctors and nurses at Cincinnati Children's are always available to answer your questions, both day and night. Remember, as a parent, you know your child the best. Do not hesitate to call the hospital if you have questions or concerns.